Hello friends, welcome to our YouTube channel by Gyan Manjari Modern School. Today's our topic is why do we fall ill for the subject science and standard 9th. Okay, we have started this chapter from the previous two sessions and also discussed about the types of diseases, acute diseases, chronic diseases, and in the last period we discussed means of diseases, means how the diseases spread. I have already written here, this is just the revision: air, food and water, contact and body fluids. So these are the four main means by which the microbes, means infectious diseases, can spread. Now if we talk about air, so very widely and rapidly the microbes can spread through air because air is everywhere. Okay students, just take out your textbook, page number 183, figure number 13.2. One person is there and in the figure it is given that about 2 meters and 4 meters. And if the droplets comes out from the mouth of the particular diseased person, so if the another healthy person is very near, very close to this person, the chances of spreading the microbes is higher. And if it is away, other healthy person is away from that diseased person, the chances are very less. It is like this, and so many chances are there. If the person is near, means in the range of 2 meters, and if the person is away from this person, chances are less, where in the less amount of disease can spread. Okay, so in this way we can say if the distance should be maintained with the diseased person. Okay, what is written below the figure? I am reading from here. Air transmitted diseases are easier to catch because air is everywhere, as I told you, and it is very much chances to spread the diseases. The closer we are to the infected person, if we are very near to the infected person, chances are more. However, in closed areas, the droplets nuclei recirculate and pose a risk to everybody. Overcrowded and poorly ventilated housing is therefore a major factor in the spread of airborne diseases. If the diseases are spread through air, these are called airborne diseases. And if it is not good ventilated or the person is very near to the diseased person, to infect, the chances are much more than if he is away from the diseased person. And the area should be open so the microbes can spread everywhere. And if it is not good ventilated, also the chances are much. So this is about the airborne diseases. Airborne diseases means the diseases which are spread through the means of air. Again, food and water we have discussed in the last period, means do not eat the contaminated food, always drink the clean food, clean water, so the chances can be minimized. Contact. Now some diseases can spread through the contact of physical contact, we can say handshake and that type of contact, the diseased person to the healthy person. But some diseases which are sexual diseases which can spread from the healthy person to the from the diseased person to the healthy person by sexual contact, and these diseases are, main example is AIDS, and this AIDS is spread through only the sexual contact and not with the help of handshake or any other physical contact. And also the body fluid, we have discussed there are three main body fluids are there. They are semen and milk of mother and our blood. So these are the means by which the diseases can spread. Now our students, next topic is it is on the page number 183, organ specific. And tissue specific. Okay, manifestations. Now, if by anyhow any microbes can enter in the body of healthy person, if his immunity is very good, then he can kill the microbes, WBC, white blood cells, which kills that microbe. But if by any chance these microbes enter in the body of a healthy person, if once it enters in the body of healthy person, where it goes? So it can goes in the cell and tissues of the body of healthy person. Now what is tissue and what is cell? Cell is the basic unit of life that we have already learned in the fifth chapter. What are the tissue? Tissues are the group of cell performing the similar function and to achieve the particular work. So these are called tissue, group of cells. And any microbe is successful in entering the body of the healthy person, there it goes and multiplies and disease can spread in his body. Now, which are the entries by which the disease microbes can enter in the person? So if this is possible, if the microbes enter through the respiration, means the air which we inhale, so definitely it will affect our lungs system. So which type of diseases can spread? Cough, cold, because if it goes through our nose inside the body, airborne diseases, so they will affect, they will damage our respiratory system. If the microbes are enter in our body through our mouth, means in the food and by the water, unhygienic food, not clean water, then it will goes inside our system, our stomach and liver, mainly liver. So diseases like jaundice can be there in the body of a healthy person. So these are the different point of entry from where the microbes are entering in the body of the healthy person, and from that which type of diseases the healthy person can suffer, that we come to know by air or by food or by contact, means sexual contact, physical contact. By physical contact, the diseases like the fungi are there, means microbes like the fungi are responsible for spreading the diseases, and body fluids also, these are the from the mother it can be transmitted to the baby, because the mother milk is the fluid which are responsible for transport of diseases from mother to the baby. Also we can discuss about the blood. If a diseased person is having the very bacteria or viruses in his blood. Then mosquito bite, the female mosquito, Anopheles female mosquito when bite the deceased person, and when it bites the healthy person, then the microbes are transferred from deceased to healthy person. In this way they are the carriers by which the microbes are transferred from one person to the healthy person. So in this way, if they enters in the body, by which means it enters, by which are the entry points in the body of the healthy person from which the microbes enter, and from that which type of disease the healthy person can suffer. Okay, and again so this bacterial infection can be avoided, but viral infection is very hard to avoid, that we will see in the next point. So these are the organ specific and tissue specific manifestation. Okay students, now we will discuss the next point, what it is, principle of treatment and also the prevention of the diseases. Okay. So friends, if the microbes anyhow enter in our body by lungs or by air, we can say by food or by sexual contact or by the physical contact or by contaminated food, so the healthy person can suffer from the disease. But if we don't want to suffer from diseases, which are the principle of treatment, means which treatment should be taken if we suffer from the diseases. So mainly there are two ways to reduce the effect of diseases. Students, what is the meaning of this? To reduce the effect of diseases. That means if we suffer from any disease or any person suffer from disease, there are it can be the painful for him or her. So here to reduce the effect, so this we can decrease, or doctor can decrease this pain in the person. This is one of the principle of treatment. Means in this way microbes are there, they are not killing, they are developing, they are growing, but the effect on the body, the adverse effects on the body can reduce. This is the first principle of treatment. Suppose we are having the loose motion, or any person is having the loose motion, so the stomach pain is there. So if by any drug or any medicine these can be reduced, then it is called to reduce the effect of disease. In this case microbes are there, they are not decreasing, they are not killing, but its effect on the body is there, it can be reduced. Suppose we are having the headache, so headache is due to the imbalance in stomach, but if we take the medicine, what will happen? It becomes, the effect can be reduced, the microbes are there. So the first way of treatment is principle to reduce the effect of the diseases. So doctor does first of reduces the effect, so the patient can be relieved, and then slowly the second way is advised or planned by the doctor. What is it? To kill the cause. What are the causes to suffer the diseases? The causes are that microbes which enter in the body of the healthy person, these are the causes. So some drugs are there, some medicines are there which kills the microbes, and this is the second principle of treatment. and due to this the microbes are killed, then the person will get relief from that particular diseases. Students, if it is the acute disease, he or she can get relief within few days, or there will no any adverse effect on the body of the person. But if the disease is chronic diseases, long period disease, then it will take time to get the person relief from that particular diseases. So these are the principles of treatment. First, to reduce the effect, means here the microbes are there, but the person is having the relief from that particular disease. And secondly, to kill the cause of diseases, means microbes can killed by any medicine and the person is getting relief. And just like to kill the microbes like bacteria, fungi, protozoas. And students, here one more thing I want to tell you. The bacteria, antibiotic drugs are there. So these antibiotic drugs means bacteria killed drugs are there. But antiviral drugs are not even now, means it is there but proportion is very low, very less of the medicines which are antiviral medicines, because bacteria are forming their own synthesis. They are having their own synthetic processes in their body. So by any medicine, if these processes can be stopped, bacteria can kill. But viruses are not having its own synthetic processes, synthesizing processes in its body. The viruses adopt the synthesis processes of that person in which he goes or where it develops. So there is a very less antiviral medicines, but there are so many antibacterial medicines, and we can say antibiotics are there, antifungal medicines are there, antiprotozoal medicines are there, but antiviral medicines are in very less proportion. AIDS is a very chronic disease and it is suffer from the HIV viruses. Now after before so many years only the HIV killed medicines are just invented, because viruses are not having its own synthesizing process. The viruses adopt the process of the person in which it enters. So it is very hard to kill the viruses, but it is very easy to kill the bacteria and the fungi, which is enter also the protozoa. So these are the two principles of treatment. Okay. Now principle of prevention. We always say prevention is better than cure. So if we take the prevention, if we take the precaution, then it is very useful for us, so we can't suffer from the diseases. Therefore, now all world is suffering from the COVID-19, and always the government and also the social groups are telling us then take the precaution, tie the masks, and for that only we are having the online teaching learning program. So this is the method of prevention, students. We are preventing our body to suffer from that particular diseases. Corona is a virus. So if we put a mask, if we cover our nose and our mouth with that mask, so this coronavirus are not entering in our body and we can get rid of that particular diseases. So principle of prevention is general method and specific method. So in general method, we will have that if it is airborne diseases, we should cover our nose and our mouth with the mask, or we should not come in contact with the deceased person. So this is one way of the general method. Suppose it is by the water unclean water and the unhygienic food, so we should avoid to eat that type of food and water. And if it is by the contact, we should avoid the contact, and if it is by fluid, then also we should avoid the fluids. So these are the prevention that generally we are taking. And the specific method means, in the specific method vaccination is there. In the childhood only the vaccination programs are there, and also we have to take care about the we have to form the immunity development programs. So the child should be immunized from the particular diseases. So these are the two general ways: principles of prevention, general method, and the specific method. Students, we will learn about this in the next session in detail. Only today you have to write about principles, means you have to learn about the principles and treatment. Students, always read the chapter carefully. You will come to know many more things. Now students, time for homework. Write short note on principles of treatment. Students, here I have written only 2 lines. Don't just write 2 lines in the homework. You have to write full short note on it. So read the textbook carefully and then write the short note. Okay students, bye, take care. We will meet in the next session.